sesamoiditis is an irritation of the sesamoids. The sesamoids are little, they're called free-floating bones in the body. They're free-floating because they're not a true joint. So they're actually just attached to your body by being anchored in by a tendon. So you have two sesamoids. Your kneecap is a sesamoid. So your patella is a sesamoid, right? So you have two of these bones at the base of your first toe. In between them is where a long tendon goes through. So they basically create a groove in your tendon, a groove for your tendon to go through. Sesamoiditis is an irritation of these bones. And again, it's a misdiagnosis because most of the time the pain that's coming from the bones isn't coming from the bones, it's coming from the nerve that's supplying the bones, which is the medial plantar nerve, which comes off the tibial nerve, which comes off the sciatic nerve. So again, our body works down and out, and it's these little roots and branches, and it goes from one big nerve that splices to smaller nerves, that splices to smaller nerves, and an irritation up at the top can cause a whole array of symptoms down below. So pain at the bottom of the foot in that area will often get diagnosed as sesamoiditis. And if you look up, they don't know what causes it, they don't have a reason for it. It could be anywhere from too much force to dietary changes to medication to basically it's an unknown etiology, right? And the reason it's unknown is because they're not looking in the right area. Conventional treatment for it would be steroids, either oral or injection, and then taking pressure off the nerve through some form of orthotic. It could be like a metatarsal pad to take pressure off it, softer shoes. Basically, it's like a combination of rest. You can elevate the other four toes, so that way your first toe doesn't have pressure on it, and then you're mainly putting pressure through the other four toes. But that's not a good solution. Those little free-floating bones shouldn't be painful. You should be able to use them as normal. And so what I do is I look to the area of the spine that supplies them. And again, this is the sciatic nerve. So it's your kind of L4, L5, L5S1 area of your low back. And if that area is stiff or painful, I mobilize that and see if it affects your symptoms down below. So often that's the case. And most of the time, I can almost guarantee that anybody with sesamoiditis that went to their doctor and had pain in this area, their doctor did not explore their back. And if you address this, you can see changes that visit. You could see decreased pain that visit. A lot of these patients, they suffer with this condition for weeks or months, and they just wait for it to get better. And eventually they'll get used to it. Eventually, maybe something will shift in their back and it gets pressure off the nerve. They'll take pressure off of it by orthotics, or they'll numb themselves to their symptoms with pills or injections, but that doesn't make you better.